Hello.
Hi,
How you doing?
I'm good.
My name is Jalen. I'm with Fadasa. I'm one of the nurse practitioner students. I'm here to do an exam on your abdominal neuro and your musculoskeletal. Is that okay?
Yes,
All right. Can you tell me your name?
my name is Russell,
Russell. And do you know what year it is?
2025.
And do you know where you are, Russell?
I'm in Atlanta, Georgia.
Okay, awesome. So I'm going to ask you to lay back. I'm just going to do a couple of abdominal exams on you. So first thing I'm going to do is just inspect the skin, look at the color, look at the temperature. Don't see any trauma. I don't see any visual pulsating. I don't see any bruising that would show a Cullen sign, and everything looks symmetric. So first thing I want to do is just listen for any bruise. I'm going to start at the aorta. Okay. I'm going to go to the renal arteries, left and right. Okay. I'm also going to do the iliac. Okay. Then I'm also going to do the femoral. Okay. Then I'm just going to take a listen to your bowel sounds in all four quadrants. Okay. Then I'm just going to percuss over your abdomen. Okay, next thing I'm going to do is also just percuss over the liver and also the spleen. Okay, now I'm also going to palpate the abdomen. I'm going to do light and the deep. So I'm going to push down on your stomach and you just let me know if you feel any pain. Okay, now I'm going to go deep. Okay, now I'm going to palpate the liver and the spleen. Okay. Okay, I'm gonna get my 4 fingers. Just trying to go underneath. Take a deep breath in for me. Okay, let go. Okay. I'm also gonna feel for the spleen here. Okay, everything feels normal. Next thing we want to do is do the liver scratch test. Just gonna get my stethoscope. Okay, next thing we're gonna do is do a couple exams. some of these tests for gallbladder inflammation or acute appendicitis. Okay. First thing we want to do is I'm going to ask you to take a deep breath in. I'm going to apply pressure. Okay. Take a deep breath in. Okay. Any pressure? Any pain?
No.
Okay. Next thing I'm going to do is I'm going to ask you to raise your leg. I'm going to put my hand like slightly above your leg here. I want you to raise it, okay? So,
Which leg?
oh, this leg. So just raise your leg for me.
Mm-hmm.
This one.
Okay.
Okay. There we go. Next thing I'm going to do is I'm going to grab your leg and I'm going to ask you to go inward. Oh, hold on. I'm going to grab your leg and I'm going to ask you to try to turn your hips inward and I'm going to like try to resist, okay?
Mm-hmm.
So hold on. So try to go inward. Okay. And next thing I want to do is called the McBurney's point. So I'm just going to apply some pressure here. Any pain?
No.
Okay. All right. Just feeling for any rebound tenderness, any pain?
Mm-mm.
Okay. So next thing we're going to do is going to take a look at your muscle joints. So I'm just taking a look at your shoulders, taking a look at your elbows, wrists, arms, toes. Can I see your knees for me, please? Okay. And I'm just looking to see and feel like any crepitus, anything. All right. Let me see your hands. Let me see your wrists. Okay. Any pain, any tenderness anywhere?
No.
All right. It's gonna do your capillary refills. Okay. Less than 3 seconds. Okay. Let me get down to your toes. Okay. And they're all normal. Since I'm down here, I'm just gonna feel for a pulse. Okay. Okay. 2 plus at the dorsalis pedis. I'll go behind the posterior tibia. 2 plus. Okay. 2 plus. And let me see your arms again. Okay. Okay. And 2 plus. All right. Now we're going to go over some range of motions. I'm going to do your neck first. So it's going to have you to tilt your head up and then chin to chest. Okay, you can look straight and then kind of move your head this way, move your head that way. Any pain anywhere?
No.
Okay. Next thing we're going to do is going to ask you to kind of stand up for me. And then can you have your shoulders out and rotate them? Okay, great. You can stop. And you can, keep them raised. And then try to have some resistance. Move them up and then move them down. Okay. And you can let your arms let down. Raise one arm up, let it down. Raise the other arm up and let it down. Okay, next thing we're going to do is I'm going to have you kind of turn this way and try to come back some and try to touch your toes. Go down. I'm just going to look at your spine for any scoliosis, anything. Okay, don't see any humpback or anything. Okay, you can turn this way again. And I want to ask you to raise one arm up and then try to scratch your back like this. Okay, you can let that one down. And the other arm, raise it up and try to scratch your back. Perfect. And then with the other arm, go behind your back, like from behind, try to scratch. Okay, and then put that arm down and then go this way with the other arm, go behind. Okay. All right, great. So you can sit down if you can. Yeah. Then we're going to do your elbows. So sling your hands out, okay? And then just bend at your elbow. Just bend. No, bend this way. Okay? So bend. There we go. All right, and then try to do one arm across your chest. Put it back. And then other arm across your chest. Yep. And then put it back. Okay. Just gonna take a look at your wrist here. And all right, looks good. And can you like place your hands up like you're stopping traffic? Okay. And then put your hands down. Okay. And can you hold one wrist and then rotate? All right. And then hold other wrist and then rotate. Awesome. I'm just going to take a look at your fingers here as well again. Okay. Close your fingers together. All right. And spread them. All right. And close them back. And then try to move them just like that. Okay. Spread them back this way. And then spread them out. Okay. And you can relax your hands now. Oh, I need to look at the snuff box. So let me just get your thumb. I'm going to flex it back. Looking for that snuff box, which is identified. Okay. Which is identified again. Perfect. I'm gonna have you lay down again for me, please. Gonna get to your hips here. Okay. First thing we're gonna do is gonna grab your leg. I'm gonna bend it. Any pain? Okay. I'm gonna have it. Can you come closer to the edge here for me? Yeah. And then I'm gonna try to push it down. Any pain? No. Okay. I'm also gonna grab it again, bring it up. I'm gonna rotate it internally and external. So you let me know if you feel anything, okay? Okay. 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 And if you sit on this side of the bed for me again. And then with your knees, I just want you to stick your legs out and put them back. Okay. And then I'm gonna move on to your ankles, your feet. Can you point your toes? Like kind of point your toes. Okay, and then push up. Okay. Push up, and then push down on my hands. Push up on my hands. Okay, and I'm just gonna grab one. Just gonna kind of rotate. Okay. Okay. Just rotate. All right. Okay, so next thing we're going to do is just test your strength. I'm just going to start with your neck. So I'm going to place my hand right here and then push forward, your neck, head forward, okay? And push your head back, okay? Then we're going to use your shoulders. I'm going to ask you to raise your arms out and then try to push up and then try to push down, okay? Now, next thing we're going to do is your elbow. So put your hands up like this and then try to push at me and then pull, okay? And then we're going to do your hips. So I'm going to have you, no, then we're going to do your hands, sorry. So squeeze my fingers, squeeze, okay. Then we're going to do your hips. I'm going to have you just, yeah. So try to push against my hands and pull out, okay. And then for the knees, I'm going to get down and try to push against me. Okay, and then pull. Okay. And then your ankles. And then we're going to do your feet here. And then push down on my hands. And then push up on my hands. Okay. The next thing we're going to do is a couple of specialty tests. This is just to see if there's any injury, like ACL injury, MCL injury. So I'm just going to do a couple of tests. So first thing we're going to do is a straight leg raise. So I'm going to ask you just to lay down. Okay. I'm just going to grab your leg and I'm just going to raise it up. Any pain?
No.
No? and I would perform this exam on the other leg, on the opposite leg. Then we're going to do a ballottement test. I'm just going to gather all the fluid around the knee, see if there's any fluid, which I don't see, which is normal. We're going to do the bulge test. Just feeling on that lateral side of the knee. Okay, which I don't feel any. Okay, now we're going to do the McMurray test. Okay, I'm going to internally rotate, and they're going to extend. Okay. Any pain?
No.
No? Okay. Next thing we're going to do is the anterior and draw test. Just going to pull. Okay. All right, which is normal. All right. I'm going to do another exam. Okay. Then we're going to do the Blackman. Okay. Then I'm going to ask you to just sit up for me. I'm going to do the sit up all the way. And I'm going to ask you to kind of tilt your head back and then look to the left. Okay. I'm going to apply some pressure here. Okay. And look to your right. Okay. And then next thing I'm going to do is I'm going to ask you to stand right here. We're going to do the drop arm and empty can. Okay. So just raise your hand up and then just see if you can just let them fall. Let them fall. Okay. And empty can, raise them up, but have your thumbs down. And then I'm going to try to have some pressure to you. Okay. Okay. Let them down. Okay. Then next thing I'm going to do is going to ask you to turn. Alrighty. Then I'm going to ask you to put your hands together, and I'm going to ask you to hold it. Any shooting pain, any like electric feeling, any pain. Okay. Gonna hold it for a minute. Okay. I'm going to ask you to extend your hands out. Okay. It's going to tap. Any shooting pain, like electric feeling. Okay. And then I'm also going to ask you to raise your hand up like this. I'm just going to let me bend, okay? Any pain?
No.
Okay. Any pain?
No.
Okay. Last thing I'm going to have you do is stick your hands out and tuck your thumbs in your fist and then push, hold down. Okay. Any pain up in here?
No.
Okay. Next thing we're going to do is going to test your deep tendon reflex. So I'm just going to start with your biceps and your triceps. I moved on to your lower forearm at the brachial radialis, and I'm going to move on down to your feet. Okay. So first. Okay, so do your triceps. Okay, do your brachial. Okay. Reflexes are good. Move on down to your knee. Just gonna have you have your foot off. And I will perform this exam on both extremities, left and right. Moving on down to the Achilles here. Kind of hard to do. Come up some. Okay. Next thing I'm going to have you do is lay down. Got to feel for the Babinski and the colonus. Okay. Just gonna. Okay. A downward fanning is a negative sign. And I'm going to do your colonus here. Okay. Let's do the other leg. Next thing I'm going to do is do a couple of tests. So first thing I'm going to have you do is just sit up for me. Okay. Get the tuning fork, and you just let me know when you feel, if you feel the vibration, okay?
Feel vibration.
Okay.
Feel vibration.
Okay.
Feel vibration.
Okay. Very good. Then I'm gonna ask you to close your eyes. I'm gonna place something. You let me know if you feel it sharp or if you feel something soft. Okay.
Sharp. Soft. Sharp. Sharp. Soft. Sharp. Soft. Sharp.
Okay. Very good. Next thing we're going to do is I'm going to ask you to close your eyes again, and I'm going to place something in your hand, and you just let me know what you feel. Okay. Okay. Tell me what is it.
Feels like a coin.
Okay. And in the other hand, keep your eyes closed and get your other hand here. And tell me what you feel.
Pencil?
Yes, very good. Yeah, very good. Next thing I'm going to do is keep having your eyes closed. I'm just going to draw something in your palm of your hand. You let me know what item or what object I'm drawing, okay?
A triangle?
Mm-hmm.
Circle.
Okay, good. And keep your eyes closed. And then I'm going to actually prick you. So let me know if you feel 2 pricks or 1 prick. It's not going to hurt, okay?
2.
Okay.
1.
Okay.
2. 2.
Okay. Very good. Next thing I'm going to have you do is open up your eyes here. And I'm going to ask you to put your finger to your nose and then but touch my finger. So finger, nose. Okay. And then again. Okay. Faster. 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 Okay. Great. Awesome. Next thing I want to have you do is pat your thighs. I want you to alternate between having your palms up and down. So up and down. Fast, 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 fast. Okay, awesome. Next thing I want to do is just have your eyes closed again and have your hands out. I'm looking for any drifting. Nope. Okay, you can let your hands down. Next thing I want to have you do is stand up. Come stand over here for me. And right here. And then just have you tap. Just try to tap as fast as you can on one foot. Okay, and then on the other foot. Okay, awesome. And then I'm going to have you perform a Romberg test. So just keep your hands close to you and then close your eyes, looking for any drifting, tremors. Okay, don't see any. Next thing I'm going to have you do is look at your walk. So I'm going to have you walk towards the door, just normal. Okay, and turn around. And then when you walk back, walk on your heels. Okay, and walk back, turn around, and walk back to the door, but walk on your tippy toes. Okay, and then when you walk back, walk heel to toe. You're doing great. Okay, thank you. Well, this concludes the exam. You did also. Do you have any questions for me?
No, thank you.
All right. Well, thank you so much for letting me do the exam.